Sure. Well, I think I use the analogy to the Goldilocks principle, which was, I don't know, someday I dreamed that up of, because it's a pun on my last name. And of course, we all know the children's story about, too hot, too cold porridge, just right. And that principle has been applied in the physical sciences and planetary science around the habitable zone around the sun. So if you're too close to the sun, it's too hot, you can't live. Too cold, you can't live. And I sort of applied that to immune therapy and Alzheimer's disease, because the idea is, at least I think we've over time learned about the directionality of change, which is we need to heat it up, we need to activate the immune system in order to at least clear the amyloid deposits present in Alzheimer's disease. But the problem with that is that when you activate the immune system, you could have untoward side effects. And so you get too hot and things start getting bad. And the same principle is that if you get too cold, things might get bad as well. But I think, at least with respect to amyloid, we've learned that you probably wouldn't do anything good by getting it too cold anyway. And there is a longer term story there that immune suppressive strategies were proposed and are still proposed in Alzheimer's disease, but had been sort of dogma for over 20 years. And my lab and other labs sort of, we didn't set out to do this, but we're driven by experimental data that says, actually, you do want to heat up the immune system, and genetics now supports that, and so does the A-beta targeting immunotherapies, because though there were many mechanisms purported for how those worked in the preclinical studies, it's pretty clear from the antibodies that have shown efficacy in humans that two properties are essential. One is engagement and binding to deposited A-beta, preferentially over soluble monomeric A-beta, and the other is having an activating constant region, so the FC region, that activates microglia. And that seems sufficient to enable clearance and reductions of amyloid load, and has been associated with clinical efficacy. It's still not perfect, but it's a start. But the non-Goldilocks, or the too hot problem, is ARIA. So these places where we get people who we still don't know what ARIA is, but for those who don't know, it's amyloid-related imaging abnormalities. It could be both small hemorrhages or edema, but it has led to death. And so that certainly is a non-Goldilocks zone result, and it will limit the, what we could do with these clinically. So that's sort of what my overview of my talk was really trying to set the stage. I wasn't talking too much about our own data in this case, but we've contributed a lot in this area, but really trying to say we have to be cautious moving forward with any immune targeting therapy because of the potential for side effects.